This is the Ohio Adult Allies Podcast. Welcome. Here, our mission is to develop, inspire, and empower youth leaders. Our topic for today is social determinants of adolescent health and community violence, with special guest, Jose Flores. Now here's our host, Christine McGill.
Hi, welcome to the Ohio Adult Allies Podcast series. I am Christine McGill, Project Manager at Ohio University. In this capacity, I work to advance the efforts of the Ohio Adult Allies Initiative, supporting adult allies to empower youth in creating social change. Today, we have the pleasure of speaking with Jose Flores. Jose manages the day-to-day operation of the LCADA Ways Community Education and Prevention Services Department in Lorain County. He and his team provide evidence-based prevention programs, mentoring programs, Tier 1, 2, and 3 programs, and the interventions for youth. His team provides student supports to thousands of youth, young adults, and their families across Lorain County. The prevention staff also provide community outreach and support focusing on communities of color. The team conducts community Narcan training and distribution, suicide prevention education and awareness for the greater Lorain County area. Jose has a background in nursing, earning a degree in the Academy of Health Sciences while serving in the U.S. Army. He is also an Ohio Certified Prevention Specialist, Chemical Dependency Counselor Assistant, a peer recovery supporter, and a master facilitator for OMA's Peer Recovery Support Training System. He serves on the executive board for Ohio Planning Council as secretary and is a board member of the Keeping It Real Peer Recovery Support Center located in Lorain, Ohio. Jose is also a member of Ohio Coaches and Mentors and serves on several advisory boards and committees. Jose has been working in the field of prevention and treatment for over 14 years. Welcome, Jose. We are excited to have you.
Now, thanks for inviting me. That's a whole lot. I got to cut down on it. But
No, it's perfect.
our staff does a lot. I hate to leave them out. We are very busy in Lorain County in Northeast Ohio, serving the community. So I like to keep it all in there. But yeah, it's just too long.
No, it shows. We need to highlight that. And that's why we wanted you to be a part of this. So the Ohio Adult Allies, we aspire to foster opportunities for individuals to engage in social action. And our focus today is going to be centered around systems and other social factors involved in community violence, how it shapes the reality of our young people, and what we can do to support that. Now, Jose, you have experience in both the medical field, military, and community work, which we thought would really lend a unique perspective. And today's conversation might feel somewhat heavy given the sociopolitical climate of today, but the hope is that this is going to spark a lot of other ideas of how we can support adult allies and young people within our different communities. But first, let's start with understanding, how would you define community violence, and how do you think that relates to social determinants of adolescent health?
Well, that's community violence is really huge, and it's, I guess it's defined as when any individual person is directly or indirectly exposed to acts of violence, aggression in the community. They can be, know the person or unknown to the person, but community violence can take place anywhere at any time. And it's not just, the school shooting kind of thing that we hear a lot about. A lot of times it's the aggression, it's the assault, it's the threatening that goes on in the communities because of, we have a very stressed nation right now. But community violence has really been recognized as a major health problem for a while now. It's something that really affects youth and affects how we live in our society. It can affect any person. It really can. I mean, community violence is all over. It's everywhere. You can't escape community violence to some degree or another. But some people are affected more, and you may not even be directly affected by the violence that's happening for it to affect you in some way down the road. You could witness it or you could hear about it constantly. The trauma that we see with youth in the schools and youth in uh, I guess economically depressed areas, we hear about them failing grades and lack of concentration and lower scores in education and reading and math. But these kids are living with gun violence surrounding them. So how can you focus on your math test if last night you were awakened at 2, 3, 4 o'clock in the morning with the sound of gunfire in your neighborhood, and you got to walk to school from that house? And so it can affect people just by hearing the violence. Something like that is traumatic for kids, especially the younger they are. The more it affects them. We look at communities of color, economically depressed areas, inner city, more urbanized areas. The homicide rate is consistently higher, and the community violence rate is higher for African American communities and communities of mixed people, Hispanics and Latinos and African American populations. We have. I grew up in Lorain, Ohio. Lorain, Ohio has a really high Hispanic population, but we also have a high African American population. Lorain was actually built around a steel mill. The people immigrated from all over the state or all over the country, from Mexico and Puerto Rico and from, other places overseas to hire folks to be laborers in this steel mill. And it boomed and boomed and boomed for like 50 years. And then in the mid 80s, it crashed. And the reason I talk about this is because you're looking now at an area that had a high population. I think at one point it was 160, 170,000 people crammed into the city of Lorain, which is not very big. We lost 100,000 people. We lost, 7 to 10,000 jobs out of that steel mill. We lost a really high income level, and now the majority of people who live in this area live in poverty. There are several schools that serve the city of Lorain, and those schools, their students receive free meals on their meals program because of the poverty level. So if you think about that, what is the gross annual median income for a city for almost 80% of the population in their school systems receiving free meals? It's really, it really devastated this area. We lost the auto industry from here. We lost industrialized support groups for those auto industry and the steel mill. All the little plants and factory and transportation businesses that were supporting those huge industries are gone as well. So since then, the violence has increased, homelessness has increased, single parent households have increased. A lot of our youth, our males, our young African American males spend time in the local jails or local prisons here because of their drug involvement. If you think about this, all of these things are kind of tied in together. You have community violence from drugs and alcohol and gangs and stuff. But a lot of this involvement with drugs is related to the lack of economic opportunity for folks. It's always a bad decision to be involved in that kind of thing. But I can understand when they say, this is my only opportunity to get a come up, is because, I can sell and make money and provide for my whatever, my cars and my shoes or my kids or my household. And a lot of people get involved for one reason or another, but sometimes they get involved because it's an economic opportunity rather than, a drug habit. So we have to look at things. How is it community violence is so connected to social determinants of health? All of the statistics talk about low income neighborhoods. They talk about African American populations, Hispanic populations being more affected by community violence. And it's not surprising to me that access to healthcare, education, quality food, nutrition, shelter, affordable housing is also an issue here as well. So all of these things are really tied together, and the youth are just so vulnerable because they didn't ask to be born in this community. They're assigned to this school, maybe one of the lower performing schools in the state. They have all of these things that are just forced upon them, and they have no resilience. And sometimes they're in a second or third generation home with their single parent household, but they're living with grandma, or they're living with auntie, or they're living with their tios, tias, and they have like a community living situation, where 2 or 3 generations are living in the same household, because of the lack of affordability, and lack of economic opportunity, lack of education. We know that people who have higher education make more money. You can have better access to health, better access to transportation. Sometimes we have one household with 2 or 3, 4 adults, and there's only one car that works. So how do we keep the income stream coming in to help support that family? And then you look at, neighborhoods who have a less amount of violence. Those neighborhoods have a higher median income, sometimes 20, 30, $40,000 higher. Those incomes that are close by, that have that higher income, they have less violence because a lot of people, they have access to healthcare, they have economic opportunity, they have good education, and I'm not saying that violence is just by, folks who don't have an education or have a low income status. That's not what I'm saying at all. So violence happens more often because people are stressed. People are living in survival mode. And I think what the pandemic has taught us is that when everybody was in survival mode, we had a lot of stuff going on, right? Across the country, across the board, no matter if you were white or Hispanic, brown, whatever, we had a higher incidence within 3 months. We had highest alcohol sales we had in the previous years, and I remember reading that statistic and I was like, you gotta be kidding me. All these people were, steady home drinking. But it was across the board, you know, and people were losing jobs and losing houses and then people were living in survival mode and created all kinds of mental health issues. And I think what it did was it brought to light, what happens when people live in survival mode. And it wasn't just, the poor communities that were affected. It was everybody that was affected. And through that, it did help us to get a better understanding of the mental health outcomes of people who are living in high stress situations across the board, whether male, female, rich, poor, white, black, Hispanic, doesn't matter. And it gave us opportunities for growth, as a country and as a health field, and opportunities as providers of services to increase access for people. We have video services now, right? We didn't have this 4 years ago. And it's a great, I guess it's a great utilization of the internet and electronic devices and tools that we can bring, not just podcasts to people, but we can also bring healthcare to people that are in rural communities, healthcare to people who live in urban or inner city communities that don't have transportation. One of the biggest things that we talk about community violence and social determinants of health is transportation. Think about this, right? Almost no transportation in this county. We have a really high poverty rate in the county. And if you go to other areas, people can't get to their jobs. People can't get there, have lower, kind of poorer health outcomes, right? You can't get to the doctor. Once we started utilizing virtual services, those things are kind of evening out a little bit, but not enough. And there's still people who don't have the infrastructure. But there are people, believe it or not, and now it's just like, really, they don't have internet in their house? What is that? So I feel, very privileged. I've never not had internet since we've had internet, but, and I was like, I thought that was a basic, like running water, electric, gas, internet. Everybody had that. But you'd be surprised. 25% of the local households here don't have it. 1 out of every 4 households. And if you think about that, that means that 1 out of every 4 households is still stuck in an age where they don't have access to healthcare virtually. Right? I could talk about this for days.
No, I think you brought up so many great points within that. And one of the biggest takeaways for me was the idea of intersectionality with social issues. It's always that question of what came first, the chicken or the egg, right? And we can't have one issue without it somehow affecting the other. In addition to that, I think the concept that community violence affects everybody. You may not directly lose someone to an act of community violence, but your community itself is affected. And we're talking about things like vicarious trauma as well, things that are affecting our young people in different ways. So thank you for highlighting. And I think you touched on this to some capacity, but why do you think it's specifically important for people who are working with young people to understand community violence when it comes specifically to youth-led prevention?
When we talk about youth-led prevention, it's so important for me to try to understand who I'm working with, right? And I have to be aware of the situations that they're living in. A lot of the youth in our local community are living in survival mode, right? And I keep trying to impress that upon people here locally. It's like these kids are living in survival mode. They're depressed, they have anxiety, they have depression, and their behavior is a symptom of some of those things that they're, living through, they're experiencing. As a provider, all my staff have been through trauma-informed care. They've been through ACEs training. They've been through assist trainings. They know how to talk to kids who are going through depression, anxiety, and having suicide ideation. They are QPR trainers. And our staff I feel like our staff is very well suited to work with youth who are experiencing trauma. And it's important for us because they have to understand that the behavior that they're experiencing is a symptom, again, like I said, of something that they're experiencing, that these youth are living through, they're exposed to. But not just that, we have to work on the resiliency piece. We really don't know if we're not addressing or acknowledging the community violence that's going around these. How do we know how to build that resilience? How do we know which resilience skills to build? How do we know where to address our focus in working with youth as an individual or as a group, a small group or a larger group or a classroom? I think that one of the things that we do well here in Lorain County is that we have a collective. We have something called Lorain County Prevention Connection, which is a lot of different schools and providers that come together and we talk about things. We also have a school crisis team in our staff. Several of our staff are on the crisis team, myself as well. And when we have something that's traumatic that goes on to a school, the crisis team will go out and we'll have conversations and we'll create safe space for youth to vent and to talk about it. As providers, we need to acknowledge that these things are going on. Or there's no youth in the state of Ohio really that isn't affected by either someone's acts of aggression or someone's alcohol and drug use, or they're affected by an overdose death or a severe loss. Or, these youth are affected by a lot of things. And they're doing things that are high risk, as a result of that. And there's a lot of studies that talks about how youth will engage in high risk behavior because of their exposure to community violence or lack of this or that, or just kind of expressing themselves in an unhealthy way.
Yeah, it kind of reminds me of this idea of sometimes people may be very quick to respond to a young person who's maybe acting out with the question, what's wrong with you? But instead, we want to flip that to like, what's your story?
What's happening to you?
Yeah. And I think that's what you are highlighting with this. And you've talked a lot about some different trainings and I think strategies in and of themselves, but are there any other strategies that can address those social determinants or structural determinants of adolescent health with a specific focus on community violence or reduction of inequities? And maybe even some successful strategies that have been implemented.
I think, well, kind of mix the answer with both questions here because they're kind of related. I was thinking about, when you asked that, it's like, ugh, first thing we always have to do is like create awareness, create awareness of the issues in our particular community. And not all communities are the same. Not all individuals are the same. Not all school dynamics or their personalities aren't the same. And so we have to look at this and then create the awareness of the problem and then try to really create a unified message to saying, hey, look, we see you, we understand what you're going through. This is a safe place, not just to talk, but to ask for help. And with that being said, we have to build trust. A lot of communities I've talked to, I work with a lot of different coalitions locally here. One of them in particular, they were trying to reach out to a certain sector and they really weren't getting any buy-in. And I'm like, you have to look at, first of all, the message, the messenger, the message and the messenger. And then, maybe take a look at how do we build trust here? How do we connect with them and without underlying intention? You know what I mean? How do we look out for the best and get them to believe that we're looking out for their best interest, not ours or not our purpose? We want to pull them into our project or our, to kind of implement some type of program, but we need them at the table. It's like, no, we need to address what their needs are. And so we have to build trust with them. We have to say, look, we're here for you. We hear you. We see you. How can we help? And one of the things that I hear pretty constantly is we have to not just create awareness and build trust, we have to build access points. We have to increase access points for people to receive that help. You can't say, come to me, I have this, but you live 40 miles away or you live 2 miles away and you don't have a car and you're handicapped. You know what I mean? So we have to increase access points. Lack of transportation is huge when we talk about social determinants of health and people just being able to progress and live outside of their community. I think one of the other things that we're seeing here happen, and I think this is really, really a great idea. One of the local hospital systems is actually putting a health clinic in one of our schools, and not just like a nurse's station, right? We're talking about a health clinic, nurse practitioners, medications, physical exams, that kind of stuff, right? And I thought, man, that's a great idea. Why aren't we doing this everywhere? Right? Why aren't we doing this everywhere? We're bringing the healthcare to the youth. But not only that, but we should be doing that in a lot of other spaces as well, right? Because youth are in a lot of spaces, right? And in that community, there may be that one school that people are going to, but there's another 30,000 students in Lorain County. What do we do with the rest of them? Getting school nurses, coaches, getting all of these folks, bus driver, anybody, get them trained in ACEs, get them trained in, child-informed practices. How do you make a safe space for a person to be able to talk to you and be with you and kind of ask for that help that they need? A lot of times we don't do that. We have to increase the amount of health literacy that families have. You'd be surprised. A lot of folks, they really don't know what kind of symptoms to watch out for. They've never had access to, I want to say, regular health care. A lot of times regular health care is when you get so sick, you have to go to the ER, and then, it's like, that's too late. So health literacy is a thing that needs to happen more and more. And how do we do that? How do we improve our health? Why it's important? How is it important for our kids and our families and our adults? Um, we need to do community policing again. And it really is important. I go back from my experience growing up in this area. We had community policing. You knew the police because they were walking around in your neighborhood, and it was not just it was a feeling of safety. It was someone that was known, so you weren't afraid. You only saw police in crisis times. It creates, adrenaline. The police are here. The police are here. But if you saw the police walking around your neighborhood every day, or walking around in the community on a regular basis, talking to people, like they're just everybody else. They just like the mailman or the fireman. They wear a uniform. And they got, we see them on a regular basis, not just when we're in crisis. And so we need to do that again. We need to create that sense of safety and familiarity with community policing. There are so many programs and so many things going on in our community that address social determinants of health, community violence. We have to assess them. What's working, what doesn't work. Not everything's a perfect fit. And you really have to take a look at that. All of these, again, and then we got to record that data. And we got to look at that and say, what's worth the money, what's not. Because money has to be involved. And the only time you really get the funding to do some great programming is with the data behind you. So that's also important too. But we have to learn how to engage people and stay engaged. A lot of folks, they'll come because they need you for a second or they have to, for court reasons or for health reasons or for whatever. They come, but you get these families with a lot of youth and you want to work with them. You want to help support them. But if it isn't worthwhile for them to be engaged with you, they're not going to stay. And then you're going to see them the next time they're in crisis. So we have to figure out a way to sustain that engagement. And a lot of places, I don't want to use the word fail because that's not accurate, but they do not see sustained engagement during times of non-crisis as important in building long-term trust and long-term stability for these families. Some of the best programming that goes on, and you'll see it in your neighborhoods and our neighborhoods or whatever, is the programs that have been a long time. And everybody knows Miss Mary. Miss Mary's always my mom always said good things about you, right? Those are the kind of programs and supports that are in place that do really well because they're known, they're familiar, they're trustworthy, and they have been engaged with them for quite some time. So, yeah, there's so much more to this.
Now, I think what I'm hearing most is not just the idea of needing to be seen, needing our stories to be told, but also understanding who is the right helper for the right environment, and then creating said environment that provides equal access to the members within that. So you also talked a little bit about data and how necessary that is. We understand the value of that. So what research gaps do you think is when it comes to our understanding of structural or social determinants of adolescent health and community violence? And what do you think we can do to address those?
Data, there are so many data collection points. We can see data from a lot of different lenses. And I mean, if you look strictly at data, the numbers alone, sometimes data can be subjective. Now, what I mean, this is a good example. There was one survey that came out in 2022. I'm not going to say who it was, but there was a survey that came out, and what it asked, or what it was talking about community violence, and it said, the headline was the proportion of children living in poverty in 2019 was at its lowest level since 1975. And that's a great data point. And they have the numbers to back that up. But as I kept reading through the report, it said, with the exception of multiracial youth, and you know, the proportion of living in poverty was at its lowest, right? And so there was an exception to it, but that wasn't right there. That wasn't in the headline. It was kind of farther down in the report, and I had to dig it out. It was like one of these little subtitles at the end of a graph box, and so I was looking at that, and then further on, it said more than 1/3 of the nearly 10.5 million youth younger than 18 lived in poverty were Hispanic, right? We are not 37% of the population. We're not. Uh, but we are 37% of the population that's living under poverty. So think about that. It's not across the board, people or there's less people, less children living in poverty. It's the white counterparts. There's less of them living in poverty. There's 37% African or Hispanics and 29% of African Americans living in poverty. They're not 29% of the population either. So, the numbers can be skewed to give you a positive outcome or improved data look, an improved data set, or they can give you a look at, they can identify some real hotspots in your data collection, right? We can say some of these things aren't looking so good, but overall, this is what we see, which is great. I love the hearing that there are less kids living in poverty. But I don't like the little subtitle in the box. I mean, that should be as big and as bold as everything else, saying, hey, look, we have a problem here. Communities of color are suffering poverty at a disproportionate rate. And so, we have to really look at that. So what do we need? What do we need to do different? I think we need to, sometimes I look at out of the box stuff, and it's like, let's not start identifying a problem, right? We know that there's a problem with poverty. We know that child poverty is an issue all over. Why don't we look at what really helps people get out? Why don't we look at these data points and saying, what are some of the families who are resilient? What are they doing different? What are some of the protective factors that are involved in their life, in their community, and in their day-to-day business? What are some of those things that really are helping them to thrive, rather than let's look at, all the things that are going wrong in this community and say, okay, let's look over here at this section, and say, what is it that they're doing that we can replicate and take over to this set of folks, and it's not all Hispanics that are living in poverty. It is this many. And, we know what's going on there: low poverty, low income, low health education, right? Other than changing the way our schools are funded, that's always going to be the same. The way it is now, it's always going to be the same. But let's take a look at the resiliency piece. What are they learning at home or in their classrooms or in their community? Or what is the general feel for their community that are supporting these people to become more resilient and to stay out of jails, to stay out of, homelessness and having problems with unhealthy nutrition, those things. So I guess, and it's really not maybe programmatic, because, a lot of the programs are in the lower income places where have high rates of poverty and high rates of poor health outcomes, right? So we aim a lot of programming there, but over here, there's a lot of people who are thriving. What are they doing? And why aren't we doing that over there? So that's kind of my take on it. I think that we need to look at data a little differently, and looking at resiliency pieces, and looking at protective factors, looking at supports that enrich those resiliency pieces and protective factors. And I think we were doing better at it with, a lot of social emotional learning, a lot of these buzzword stuff that we created. And we're going into schools and we're teaching a lot of the stuff. And now, there's a lot of pushback on the word social emotional learning. So let's call it something else. We're trying to build resilience in these kids, right? We'll call it whatever you want, but let's get back in there and do these things and look at the data at some of these other areas and try to figure out how we can implement practices that steer a lot of these other communities into healthier and being healthier individuals. Kids make bad choices. They always do, whether it's drugs, alcohol, sex, whatever. They make bad choices. And we can educate them on why they shouldn't. But there has to be a hook there, right? It has to be able to pull them into an area where they say, this is worth it for me, right? To make better decisions. This is worth it for me to live a healthier lifestyle. This is worth it for me not to be involved in drugs and alcohol or gangs or gang violence or theft or criminal activity. There's got to be something in it for them. And we need to find that hook to help them stay, heading in a positive direction. Everybody wants kids to be successful. They're our next generation, right? I cringe sometimes. I think these 12, 13, 14-year-olds I'm working with or see at school, they're going to be, lawyers and doctors. And we want to get this right.
Now, I think that you brought up several different points, but one of the biggest pieces that I took away when we're talking about that data piece is that we want to ensure that all populations are being represented accurately. When we're talking about sample sizes and studies, that we're having diverse participants within those studies so that it effectively represents our communities.
Oh, absolutely.
And I've seen a pattern when I've done some of these podcast episodes. One of the biggest patterns I think that I've seen, or most important patterns that I've seen, is this idea that we need to focus more so on the strengths of our young people, of our communities, of our helpers in the world, rather than the deficits that we have currently. And that's huge, I think, mindset that is going to really create change within our world. So thank you for that. Is there anything else you want to highlight before we leave?
Well, we talked about a lot. There's just so much more to this. Everything is interconnected, and really, I struggle sometimes on where to start, right? And I think a lot of people do. We look at the issues and we look at the things that are going on in our communities and with our young people, and sometimes it's overwhelming. But I would challenge anybody just to start somewhere, right? You don't have to be good at it. You don't have to be great at it. It doesn't have to be in your comfort zone. We all need to take a step towards solving some of these issues, even if you don't think it's the right one. If it helps one person, then it was the right. So for all of the folks that are really out there working with youth and feeling overwhelmed, I just want to say that every little positive step that you take is worthwhile. It's worth exploring and it's worth doing. Keep up the good work.
Thank you. I love that. No matter what you do each day, you don't know the impact that you have on someone, even if they don't tell you. So, Jose, thank you so much for all of your insights today. We definitely appreciate the work not only you, but also your team are doing throughout Ohio. It is evident that you all are really set to change for a lot of the people in your area. So I am Christine Miguel, and on behalf of the Ohio.Allies team, we hope that you enjoyed this conversation. Feel free to check out other podcasts on the Ohio.Allies website. And as always, embrace, embolden, and empower whenever possible. Thank you.
Thanks for having me.
We would like to say thank you to our special guests. For more information about their organizations, feel free to use the information on the screen or below in the description. Thank you to our listeners. This has been the Ohio Adult Allies Podcast. For more episodes, you can find us on Spotify, iTunes, Google Play, YouTube, and more. You can also find our episodes and more information about us on our website, ohioadultallies.com. And again, thank you.